You always have to evolve. And robotic surgery is simply evolving and putting the best tools in the hands of the general surgeon. So I saw that and saw that I can evolve my surgery and give the best benefits to the patient only with robotics. My name is John Muffoletto, general surgeon living in Anchorage, Alaska for 28 years now. Robotic surgery is a very advanced form of minimal invasive surgery. There is the actual robotic arms, so that's the robot that is wheeled and positioned over the patient, and then those instruments get inserted through ports into the abdominal cavity. And then there's the brain part of the robot, which has all of the computer feedback and what's going on and storing all the imaging and data and allowing all things to move with speed. And then there's the actual console that I'm operating on. So I sit, eyes go into a console, 10 times magnification. You can move with great dexterity and then see things and do all your minimal movements in a very heightened minimal invasive form. So it's just a very advanced minimal invasive platform. You can use small incisions, right? So now the problems that you would have with a large open incision go away. So you don't have wound infections. You don't have mesh infections occurring anymore because that large incision is gone. The amount of healing that is required is much less traumatic. The whole inflammatory response that you have to trauma is much less than what it would be with traditional surgery. So the healing time is quicker and pain is less. People return to work quicker. All those advantages. Hernia repair I've been kind of fascinated with for years. I love the anatomy. It's very elegant, no matter whether it's in the groin or the abdominal wall. The hernia repair is just very rewarding to me because I see the patient have immediate benefits from that surgery. They came in debilitated, and then weeks later, their life has turned around.